Welcome back to Living Local. Over the years, the issue of juvenile crime has been getting more attention as communities discuss what can be done about it. A local mental health center is offering a newer treatment option that strives to decrease juvenile delinquency and incarceration by empowering youth and families. Joining us via Zoom with more on that is Dr. Richard K. Whitaker, CEO of Vera French. Dr. Whitaker, thank you so much for talking to us today.
You're welcome. Thanks for having me.
Okay, so Vera French offers something called multisystemic therapy, or MST. Can you tell us what MST is and how it kind of came about?
Sure. The Vera French MST team includes the expert child and family therapist and team supervisor Joyce Morrison, therapist Hector Meneses, therapist Jessica Bartz, therapist Matt Johnson, and intern Cassandra Delgado. Our MST team is actually quite diverse, with each coming from different backgrounds. One with substance abuse treatment background, one that worked in residential treatment centers, and those with child protective services background and school-based therapy background. And they're able to look at each case or problem from 4 very unique angles. The MST team actually started up in June of 2019. We worked with a total of 60 high-risk youth and their families since then, and it was funded originally and continues to be funded by local grant dollars from the Hubble Waterman Foundation, Genesis Philanthropy Foundation, the Scott County Regional Authority, the Regional Development Authority, and recently a grant with the Juvenile Court Services in the 7th Judicial District.
So they work with the family, if I understand this right, and try to fix the environment around a young person rather than just trying to fix the person, if I get that right. Now, they've had some great success. Is that correct? So what's all gone on with that?
Well, you know, we know that more and more children and youth are struggling with depression, substance abuse, behavioral problems, especially since the start of the pandemic. And efforts to fix the youth, so-called fix the youth, in juvenile detention or residential treatment or even boot camp type programs only result in a revolving door, because the youth go home after these highly structured programs to the same old problems in their home, in their school, their neighborhood. Vera French Multisystemic Therapy, or MST as it's called, is a highly researched, evidence-based model that takes a very different approach. We work to identify and solve the root causes of the acting out behavior by helping parents and guardians engage youth in pro-social activities, provide excellent supervision and monitoring, repair broken relationships between the parents and youth, and we engage school personnel and other interested persons, maybe a family member from across town or a neighbor that's really involved with the family. We help them involve the youth in proactive solutions. And you know, they work really hard to continually focus on how the youth's problematic behavior makes sense in their environment, finding the fit between the environment and the behavior, and then working specifically on the most primary driver or the primary cause of the problem, and then helping the family and others change patterns or sequences of behavior for long-lasting change.
Dr. Whitaker, what sort of situation is MST designed for? Like, is there a problem that's too tough for this type of approach?
Well, you know, we serve youth ages 12 to 17 who display significant behavioral difficulties that place them at risk of residential placement or juvenile detention. And we don't cherry pick our cases. Unless the youth has pervasive developmental delay or a serious mental illness such as schizophrenia, we'll accept the youth and family for MST. We work with kids with weapons charges, violent and acting out behavior, running away, gang involvement, substance use, a host of other issues which are tough, but not, in our opinion, not insurmountable. Providing MST requires that we do our part to take tough cases and seek to make changes, and we absolutely take on the difficult ones. We never shy away from a challenge. The only cases we turn away are those that maybe don't meet our criteria, but we see potential in everyone that we work with. And we serve referrals sent to us from probation, Department of Human Services, school counselors, social workers, even self-referrals. sometimes that initial intake, just that we get, it doesn't tell the full story of that youth. And some are actually more difficult than the paperwork describes. And sometimes the youth just have hit a rough patch and maybe need a little redirection or guidance to get back on track to what they were doing positively before the incidents occurred.
Remind me if you already talked about this, but how is it funded? How do you fund MST, and where's this going in the future?
Well, currently MST is funded through some generous grants from community grantors that I described. We also now have the Iowa Mental Health Block Grant paying a little bit towards MST, and we have a great contract with the Scott County Juvenile Court Services. But the real key, and this is what I'm trying to talk to legislators about and our DHS officials here in Iowa, we're working on getting Medicaid funding for youth that are on Medicaid so that they and their families can get multisystemic therapy. And actually, Medicaid funds MST in many other states across the country, and it's been doing so since the late 90s, early 2000s. So Iowa really wouldn't be doing anything new by paying for MST through Medicaid. And there are lots of other organizations across Iowa that have contacted Vera French and asked about multisystemic therapy and how they can start up a team.
Now, if you're someone who's a parent or somebody who knows a young person who is struggling and you think they might benefit from MST, how do they go about getting help for that person or getting referred to you or anything like that?
Well, for a referral or maybe just further information about MST, they would contact Joyce Morrison, our supervisor. The phone number is right on our website, 563-949-1812, or they can email Vera French, morrisonj@verafrenchmhc.org. But also, there's contact information right on our webpage at verafrenchmhc.org or our Facebook page under the Vera French Foundation. But I also wanted to just say that we've had great success. 90% of all the youth we've worked with, and I talked about working with over 60, and we've actually completed with 45 out of 50 youth, 90% have completed MST. And in our follow-up studies of the 22 youth and families we attempted to contact 6 months after discharge, 17 out of 17 of the ones we were able to talk to were continuing to meet all their outcomes, no arrests. They were in school or working, no or significantly reduced substance abuse, and currently living at home with no out-of-home placements. And of the 12 youth who are already 1 year post-discharge, so they finished the program, and 1 year later, we attempted to contact them, and out of those 12, 8 we were able to talk to, and all 8 were continuing to meet all of these same outcomes. So these are long-term great outcomes coming from MST, and we would hope that people would find hope in that and recognize that all is not lost, that there is hope, and programs like MST really work, and they work long term for youth and families.
Absolutely. Dr. Richard Whitaker, CEO of Vera French. Dr. Whitaker, thank you so much for talking to us about multisystemic therapy today.
You're sure welcome. Thank you.
All right. If you would like more information, Vera French's website is on your screen there, verafrenchmhc.org. We'll also have those details posted on our website too, ourquadcities.com.